Pete, thank you. Depression can feel crippling, but there are ways to understand what's happening and how to address it. That includes steps that you can take at home and some you'll need some professional help with. So Julianne Popelka is the CEO of the American TMS Clinic. Dr. Husheng Aminian is the doctor at the American TMS Clinic. Hello to both of you. Thank you for being here. First of all, tell me, what is the American TMS Clinic?
It is a psychiatric practice located in Scottsdale, Arizona. We've been around for about 3 years now. We see a lot of lives changed using a very revolutionary non-drug-based treatment.
What is brain mapping?
Brain mapping is a fundamental process of the transcranial magnetic stimulation whole treatment, and we go one step beyond, where we actually get visualization images of the brain before, during, and after treatment, so we can see a change.
So, Doctor, depression literally impacts our brain. Tell me how we can see the impact of it during this brain mapping.
Well, the brain cells that are called neurons communicate with each other and help us function with magnetic fields. And when something goes wrong, whether it's an external factor like a blow to the head injury, or if it's a tumor or bleeding or intoxication, and emotional factors such as sadness, losses that cause people to become unhappy.
Yeah.
These make those neurons not to function as before, and sometimes certain areas of the brain works faster than usual and sometimes slower than usual. This imbalance causes the problems such as depression and anxiety.
How often is the treatment? What does it feel like? What does it look like?
Well, the individuals would have to be evaluated to make sure that they truly suffer from depression or anxiety or some other diagnosis that TMS works on. And if they are appropriate for this kind of a treatment, it can be started after we do the evaluation and the EEG and a few sessions, depending on the patient. Sometimes a course of 20, 30, 36 is needed, and sometimes a little bit more, depending on the severity of the problem.
And this, of course, is done with a professional medical care. There are some things on social media, you know, the place where people go to for information on their health, Julianne.
No.
So tell me about some things that we want to make sure that we don't do to preserve our mental health and to do good by it.
Yeah, so there's a lot of trends on the internet specifically targeting, like, oh, you can fix yourself at home treatments, these no doctor remedies, and it's actually quite dangerous because without proper clinical oversight, harm can be done. Seizures are a risk. Side effects are a risk, and we're so fortunate to have such a low side effect rate and such a high success rate in our clinic because we are so careful to make sure that everyone's getting exactly what they need, where they need it. At-home treatments done by someone without oversight, it's very easy for things to go very awry. So.
And it wasn't too long ago, it's rather recent, that the FDA cleared treatment options to help patients as young as 15.
Yes.
So what does that do as far as helping our younger people nice and early in life?
That's a very important step because providing treatment for the younger population has always been difficult. And this is a treatment that does not have any major side effects or issues, pain or misery, or causing, symptom side effects that younger individuals would become against it or want to have resistance towards it. It's very simple, very easy. They become engaged with it so easily, and it works without any of those troubles that other treatments can do.
Sounds like it could be a miracle worker for some. American TMS Clinic, thank you to both of you. Thank you for coming in and sharing
thank you,
with us. We appreciate it.